Good evening. I'm Dr. Robert Peppercorn. This is the Yuba City. As a specialist in skin diseases and allergies, and as host of this program, I will take you on an exploration of the medical communities of Yuba and Sutton counties and bring you behind the scenes of medical right here in our local area. I have a fascinating program for you tonight as we learn about an area of medicine that allows doctors to look into your heart without the need for any surgery and the important need for pain. We don't want that. Tonight, the Medical Explorer will take you into the diagnostic medical specialty called nuclear medicine. We will also have the opportunity to meet our area's most highly skilled specialist in this area as he demonstrates the remarkable nuclear that is available as residents of the Yuba City and Marysville area. This is an extremely interesting, rapidly developing, and important subject, and I hope that you can keep your TV dial right here on Cable Channel 5 for the next half hour. Before getting to our topic tonight, let's take a look at the latest medical news. Good health news for birth control pills. Women on the pill don't run any greater risk of breast cancer than women who've never taken oral contraceptives, a major government study says. The new findings contradict two 1983 studies that link the pill to breast cancer in young women. Researchers at the National Institute of Child Health and Human Development and the Center for Disease Control interviewed 2,000 women with breast cancer and 1,000 healthy women. All women in the study were 20 to 44 years old, and there was no significant difference between the two groups' use of the pill. 80% of the breast cancer and 80% of the healthy women took oral contraceptives. 200 of the women with breast cancer and 200 healthy women took the pill for more than 4 years. 30% of the women with breast cancer had a family history of the disease, compared with only 20% of the healthy women. About 70% of the U.S. women, 70% of women in the United States, take the birth control pill sometime during their childbearing years. This study appeared in a recent issue of the British medical journal called Lancet. The same high-energy used to destroy kidney stones may prove to be a new treatment for cancer. Researchers at the Kettering Cancer Center in New York found that the reproductive rate of cancer cells tubes decreased with the number of shock waves that the cells received. In a second experiment, cancer cells were injected into animals, showed a decreased ability to form tumors. And in a third, the tumor growth rate was delayed for 5 days in cancer animals that injected to these shock waves. The researchers hope that eventually the waves can be used with other forms of therapy to treat cancer patients. These findings are of the American College of Surgeons. Scientists have developed a synthetic blood that may substitute for human blood and other emergencies. But tests are several years away. Researchers in Chicago successfully used the substitute to replace the blood of rats, rabbits, and dogs. They will next try primates. The synthetic blood can be stored for months-long natural blood and could be given to patients without regard to their blood type, which could be life-saving in rapid emergency situations. It may also reduce the transmission of AIDS and other diseases spread by blood transfusion. In my health tip tonight, I'd like to talk about an area that you need to watch for if you're asked to sign up for a new health insurance program. Many of your employers will soon be asking you about signing up for new and cheaper forms of health insurance. Some of these insurance programs will take away free choice in the healthcare system because of a new concept called the gatekeeper system. Gatekeepers are often found as part of PPO or foundation-type health plans. The gatekeeper will not allow you to choose your own medical specialist. The gatekeeper will require you to see one of several selected general physicians first, and it will be up to that general physician to determine a specialist for your care. The gatekeeper system could prohibit you from seeing your favorite ophthalmologist, gastroenterologist, urologist, allergist, and even dermatologist without getting a written okay from a set list of general physicians. Even your favorite general physician might not be able to see you with these new plans. You to find out if your new medical HMPPO or foundation plan will restrict your freedom of choice with a gatekeeper before you sign up for the plan. Fortunately, most insurance plans in the area do not require a gatekeeper. Keep your eyes open because the gatekeeper plans are coming and could end your freedom of choice in the healthcare system. Now, on with the Medical Explorer. What comes to your mind when you hear the word nuclear? Is the idea of a new type of way to look into your body without painless surgery just right into your mind? Well, after you meet special guest, I'm certain that you'll think of the word nuclear in a much different way. Let's visit Fremont Medical Center now and guest radiologist and nuclear medicine specialist, Dr. Owen Van Kirk. Dr. Van Kirk, thank you very much for joining us to the Medical Expert. I always like to begin, as you know, by having my guests tell us about their educational background and training. Where did you go to school?
Well, I took my radiology training at Walter Reed Army Hospital for 3 years.
Is that in Washington?
In Washington, D.C., that's right. And then I took 2 additional years of residency in nuclear medicine, which is what we're dealing with today.
So after, what about medical school?
And that was at, nuclear medicine was in the Northwest, a year at the University of Oregon and a year at the University of Washington. Medical school was Loma Linda University in Southern California.
So you had the usual training of college, medical school, 4 years, right. Then residency in radiology, which is about 3 years?
3 years, yeah.
And then 2 more. That's what you need to become a board-certified radiologist.
Right. In fact, they just increased it to 4 years now. But
it's now full-time was 3. Yeah. You finished that, but then you went beyond, and you got even more specialty, subspecialty training by studying 2 more years in nuclear medicine, which is what our subject is tonight.
Right.
Nuclear medicine brings to mind thoughts of physics and atoms and nuclear bombs and nuclear reactors. What exactly is meant by nuclear medicine? What does that mean?
Some people have turned the first 2 letters around and called it nuclear medicine, but it's a little hard to define. But nuclear medicine is a specialty that involves imaging, primarily imaging the body, various organ systems of the body, with the use of radioactive materials. And for most of the majority of our studies, we use one radioactive material known as technetium-99m. And we make that go to different areas of the body depending on what we hook it to.
When we say these are nuclear radioactive materials, they're actually releasing radioactivity or X, gamma rays, different like that. Is that true?
That's true. The difference and nuclear medicine are related. They're both methods of imaging the body. Radiology involves sending X-rays all the way through the body, whereas with medicine, the radiation is in the body and then comes out and reaches our detector.
So this is really given in the body through an injection, we might say, in a vein? Is that possible?
Most often an injection in a vein, occasionally breathed in or ingested orally.
So we're talking here not major surgery or invasive technique. Isn't that your non-invasive technique?
That's a big advantage of it, and also some of the heart studies we're going to see today.
So with nuclear medicine, what areas of the body, besides to see now, what other areas of the body can you actually look at without going in and out, without doing surgery?
I was just checking our request slip. We have about 25 studies that we can do, imaging almost every part of the body, and so it's quite comprehensive.
So thyroid, lungs, and kidneys. And
we can do brains going from head to stern. We can do brain scans and thyroid scan, lung scans, and images of the liver and the kidneys and the bones, looking for abscess or blood loss in the intestinal tract. And there are others too. Since
these are radioactive chemicals, an initial feeling might be, gee, it's dangerous to get near these things. Having it put in your vein might be dangerous. Is it dangerous? Are these that chemicals?
Well, the field is heavily regulated by government agencies as to how much we can administer. And interestingly, there are certain organ systems that can be imaged both radiology techniques and with nuclear medicine techniques. And not uncommonly, the patient will receive less radiation with a nuclear medicine approach.
So it's not nearly like getting an X-ray or a test of a lung, a chest X-ray as an example. You're getting less.
I'm not sure about the lungs, but for instance, the kidneys. IVP is a common way of
fluoroscopy and that sort of thing.
It's a common way of imaging the kidneys, and it's done more often because you see more detail. But actually, you get more radiation with an IVP exam than you do with a study of the kidneys with nuclear medicine, for instance.
And so I suppose that would apply to like an upper GI series would be a lot more radiation than you with most nuclear tests. Or
that would be. We don't have a comparable study for.
Okay. I understand what you're saying. These chemicals then that are radioactively active are injected in the body and then can go to different organs. It's then the radiation in that chemical that exposes itself onto a piece of... Is that how it works?
We expose a film, but in nuclear medicine we need a more sensitive detector and what we call a camera. And it's a sodium crystal which detects the gamma...
Yeah.
Good evening. I'm Dr. Robert Peppercorn, and this is the Yuba City Medical Explorer. As a specialist in skin diseases and allergy, and as host of this program, I will take you on an exploration of the medical communities of Yuba and Sutter counties and bring you behind the scenes of medical care practices right here in our local area. We bring you another interesting program tonight as we explore two interesting medical subjects. Tonight, our Medical Explorer cameras will take us into the new diagnostic cardiology laboratory of the Rideout Hospital. Rideout has recently acquired one of the most modern medical machines available that can look into the human heart and into blood vessels of the body without any needles and especially without pain. Also tonight, we'll show you the latest treatment that can remove unwanted wrinkles and scarring from your skin without the need for painful plastic surgery. This treatment is called injectable collagen, and I'll show you how it's used later in tonight's program. These will be extremely interesting demonstrations, and I hope that you'll stay with us for the next half hour. Before getting to our topic tonight, let's take a look at the latest medical news. Just one blistering sunburn as a child or teenager is enough to double the risk of melanoma in later life, according to a new study from the Harvard Medical School. Fair-skinned people, those who burn easily and those with a family history of skin cancer, are most susceptible to the potentially dangerous and deadly form of skin cancer. The link between sun and melanoma is different than that for less life-threatening forms of skin cancer. For these other forms, the risk is directly related to cumulative exposure to the sun over an entire lifetime. Dermatologists feel that children should be protected from excess sun exposure to help prevent all types of skin cancer later in their lives. About 400,000 people in the United States develop skin cancer each year, including 23,000 cases of malignant melanoma. About a fourth of melanoma patients die of the disease, compared with less than 1% of those with other forms of skin cancer. Melanoma, especially on the arms and legs, is increasing at an alarming rate. Its incidence has doubled in the past 7 years and risen 7-fold since 1940. Cigarette smokers who kick the habit seem bound to gain weight, according to a new study of middle-aged smokers. Researchers at the University of Louisville studied 13 female heavy smokers who quit. They observed that 1/3 of their weight gain could be blamed on nicotine-related changes in their metabolism. The other 2/3 were the result of eating more. As non-smokers, the women consumed an average of 227 more calories per day. The researchers feel that the lack of an after-meal cigarette could be a factor. For a smoker, that's usually a sign that the meal's over. Now they suddenly don't have the marker anymore, so they continue to eat and they continue to gain weight. A test to identify people who are genetically prone to heart disease could be available within 3 years. The test could help with the early diagnosis and treatment of people with an inherited inability to clear their blood of artery-clogging cholesterol. The new test results were reported in a recent issue of the New England Journal of Medicine. The condition is called hypercholesterolemia, caused by the abnormal gene. It affects about 1/2 people in the United States, but often goes undetected until the victim has a heart attack. New drugs will soon be on the market to help control the life-threatening disease. The new test could be used as a screen to screen early young children at risk. Early diagnosis could allow special diets and early use of new drugs to prevent future heart attacks. Now, on with the Medical Explorer. Have you ever wondered if there's a simple way to make facial wrinkles and acne scars less noticeable? Is it necessary to resort to painful, expensive plastic surgery to improve the appearance of your skin? For the past 4 years, dermatologists like myself have been using a new product that can truly improve those lines around your mouth, nose, and forehead. This new treatment does not require any surgery, and it's simply done in the office. The medication is called Collagen, and recently there's been a breakthrough in a new, longer-lasting form of this injectable material. Let's take a look at these new products called Juvederm and Zyplast Collagen.
Zyplast implant is a new form of injectable collagen developed by Collagen Corporation for the correction of soft tissue contour defects that require subdermal implant placement. Zyplast implant has been cross-linked to afford the stability necessary for augmentation of subdermal tissues. Cross-linking is accomplished with glutaraldehyde, which produces covalent bonds within the collagen fibrils to stabilize the implant lattice. Virtually no glutaraldehyde remains in the final product. Studies indicate that Zyplast implant offers several advantages. It permits durable correction of subdermal defects. There is minimal shrinkage after injection. And there is a low rate of immune response. As with other forms of injectable collagen, Zyplast implant is not a permanent material. It is important to understand that there are notable differences between Zyplast implant and Zyderm collagen, both in product characteristics and in injection technique. Zyderm 1 collagen is easily dispersed intradermally. Because of its forgiving nature, Zyderm 1 collagen is very useful for superficial intradermal augmentation of shallow defects, particularly in thin-skinned areas. Zyderm 2 collagen, because of its higher concentration, does not disperse as easily as Zyderm 1 collagen and requires less overcorrection than Zyderm 1 collagen. It is more appropriate for defects in thicker skin or where deposition of more collagen per injection is indicated. The advantages of Zyplast implant, with its more stable fibrillar structure, are most apparent when the product is placed subdermally. When used intradermally, Zyplast implant has often led to whitish beading persisting 6 months or longer. Therefore, Zyplast implant should not be placed intradermally. Zyderm 1 and 2 collagen are both administered intradermally through a 30-gauge needle. With Zyplast implant, either a 27 or 30-gauge needle may be used. Due to the subdermal placement of the material, investigators have generally preferred 1-inch needles for use with Zyplast implant. Zyplast implant is indicated for a wide variety of soft tissue defects where subdermal placement is required, such as deep nasolabial and glabellar furrows, oral commissures, and other age-related contour deficiencies. Acne scars, skin graft depressions, and disease or trauma-related scarring, inadequate malar prominences, and various atrophic conditions. Before treating with Zyplast implant, an intradermal skin test must be administered to identify patients who might develop a local hypersensitivity response to the implant. The importance of this skin test cannot be overemphasized. 0.1 cc of Zyderm collagen is used for the skin test, since it is a more sensitive test material and will better identify those patients with a tendency to react to bovine collagen. The test site is observed closely for 4 weeks for signs of hypersensitivity, such as redness, swelling, firmness, and itching. Over 70% of all test reactions occur within 72 hours. Therefore, either the physician or a qualified assistant should view the test site at 3 days after injection. The test site should be evaluated again at 4 weeks. Patients with symptoms lasting more than 6 hours or occurring after 24 hours are excluded from treatment. When test results are ambiguous, the patient can be retested in the opposite arm and reevaluated in another 4 weeks prior to treatment. During treatment, the implant is injected either subdermally or at the dermal subcutaneous junction. Dr. Samuel Stegman comments.
This patient has multiple types of acne scars, depressed and ice pick type. The Zyplast injection will work best for the soft, depressed scars. It is placed into the subdermal area, the dermal-subdermal plane, where it will flow very easily from the syringe. Sometimes I need to pick up the skin in order to inject it into the right plane. Other times I need to stretch the skin and rest the syringe on the bottom of my thumb. It is important to place this below the skin, and by doing that, one will have less chance of pore extrusion. Also, there will not be blanching, but rather just a gradual lifting of the depressed scar. Once Zyplast is in the right level, it can then be molded or sculpted so that it is moved to exactly the right place beneath the scar. Here the patient is immediately after treatment. And that compares with before treatment, where you can notice that the depressed scars are much more visible. He may need later Zyderm treatments, more Zyplast, or some other type of acne scar treatment. This lady has nasolabial furrows, as well as depressions at the inferior edge of the oral commissure, which give her a rather drawn appearance around the mouth. In treating the nasolabial folds, we use the subcutaneous threading technique. This technique is much more successful with Zyplast because it is in the subcutaneous plane than the threading technique was with Zyderm, which was intradermal. The material is extruded both as the needle is advanced and as it is withdrawn. After the proper amount is placed, a small amount of sculpting is possible. In treating the depression at the inferior edge of the oral commissure, we are now able to correct a problem that formerly we were unable to improve. By improving this downward appearance of the mouth, the whole face takes on a much more pleasant appearance. It is important not to overcorrect, and one needs to put in only the amount necessary to bring the skin up to the natural surface. On treating the other nasolabial fold, again demonstrate the subcutaneous linear threading technique. Notice how smoothly and evenly that entire fold will elevate by putting the material in the subcutaneous plane. On this patient, all of these areas were treated with 1.25 cc's of the material. Here she is shown immediately after treatment, and compare that with the deepness of the folds and the oral commissures before treatment. This oblique view shows the same improvement. Approximately 1 week later, we can see that this improvement has been retained, and she has a much more pleasant appearance than without the Zyplast injection. This lady has what we call sad pads. That's a depression at the middle of the lower eyelid. For the first time, we're able to treat this in a simple way with Zyplast subcutaneous injections. The material is placed under the skin, carefully, not so as to blanch the skin, but to put it under the skin and fill in that depression. These sad pads give the patient a drawn or unhappy appearance. Rather than the smooth, semicircular line between the lower eyelid and the cheek, they have the depression which gives them an unhappy appearance. The Zyplast is placed into that area, carefully not to overcorrect. The implant can then be sculpted with the fingers by pressing against the inferior orbital rim. Notice the patient before with a sad appearance as compared with afterwards, where that appearance is gone and she has a much more pleasant appearance. This is the lady 1 week later, showing a retention of the correction. However, it is obvious that I should have placed more on the left side and will do so in the future.
Dr. Arnold Klein comments.
This patient is well known to me, and she's had Zyderm injections in the past. The most prominent area of her face that bothered me at this visit was the left oral commissure. And I planned to place Zyplast in this area because I felt Zyplast would give her better correction at the site. As you can see, I'm using the serial puncture technique, but I'm avoiding any blanching. I'm using my needle more perpendicular at a greater angle than I would with Zyderm, and additionally, I'm pressing the needle down till I reach the border between the deep dermis and the subcutaneous fat. You sort of know you reach this area because once you pass it, the resistance of the needle gives way. And I'm using a very small amount to correct the oral commissures. For both oral commissures, I'm using a total of approximately 0.3 cc's of Zyplast. You can see the very superficial area of the right nasolabial or mesolabial line is being corrected with Zyderm, and here I'm using the needle more horizontally. I'm getting blanching and overcorrection, which is what you utilize with Zyderm. So in contradistinction to Zyderm, what you previously saw was Zyplast, which is injected in a serial fashion using small amounts of material at the deep dermal subcu junction. And here's before, and this is now again after the patient's been injected. This patient came to see me basically because she felt she looked sad when in fact she was not sad. And for this reason she wanted to have some cosmetic correction of what she felt were her facial defects. She did not want to undergo facial surgery. because of the size of the defects, it was elected to use Xiplast instead of Xiderm. And here again you can see utilizing the serial puncture technique at the deep dermal sub-Q level. Serially puncturing, you see very little pore extrusion because you're so deep you do not get the degree of pore extrusion that you might see with Xiderm. Xiplast is a bit more difficult to inject because it doesn't have the flow characteristics of Xiderm in that you don't have the microfibrils, and additionally you avoid overcorrection with Xiplast because it is a latticework that holds in the fluid and you do not get resorption that you normally see with Xiderm. So thus you use serial puncture technique, you use it deep, the sub-Q dermal junction, and you do not overcorrect. Nevertheless, after you've placed Xiplast down, you can use a little Xiderm to touch up at the sites, and here you can see the Xiderm extruding because you're putting it sort of superficially. But it helps to, let's say, finish up and touch up the defects that you've already corrected deeply with Xiplast. This is the patient immediately after injection, and her total face has been injected with approximately 1 syringe full of Xiplast, and this is the before picture. She's a much more pleasing looking to herself individual after the injection.